Hi, I'm Madison Rose, and today I'm going to show you how to do an ear swab, how to stain for ear cytology, and how to set an ear mite slide. You may have to do an ear swab and ear cytology slide if you suspect there is fungi, bacteria, or yeast infection in the ear. A cytologic evaluation is a diagnostic tool that has the ability to offer a diagnosis, aid in prognostication, direct therapeutic interventions, and suggest further diagnostic testing. Also, an ear mite slide is prepared if there is ectoparasites suspected in the ear. For supplies, you will need gloves, Q-tips, 2 microscope slides, a cover slip, mineral oil, diff quick stain, and a lighter. To begin with, put on your gloves and collect your 2 microscope slides and label them. One slide should be labeled with the pet's name, date, and ear cytology. The other slide should be labeled with the pet's name, date, and ear mites. Once the dog is restrained, take a Q-tip and lift the pinna of the left ear. It doesn't matter what ear you start with, just make sure to do both. Using the Q-tip, place it carefully down into the vertical ear canal and then gently make a circling motion, collecting the sample. Make sure to not hit the tympanic membrane because that could be dangerous and damage the dog's ear. Make sure to bend the stick portion of the Q-tip into an L shape so you can denote the sample from the left and right ear. Roll the sample from the left ear gently onto the center of the microscope slide. Next, use a different Q-tip and get a second sample from the right ear. Roll the sample from the right ear gently onto the edge of the microscope slide. If ear mites are suspected, take the additional slide you labeled with ear mites and put a drop of mineral oil on it. Then roll the sample from the ear into the oil and place a cover slip to examine it under low power. Ear mites usually cause a dark brown, crumbly discharge in the ear canal, excessive scratching at the ears, head shaking, and a crusted rash around the ear or in the ear. They are the most common cause of ear disease and infection. Also, Demodex mites can also be seen on ear smears. For the ear cytology slide, once you have rolled the sample onto the slide, you have to lightly heat fix the slide by waving a lighter under the bottom of the slide a few times and wipe the bottom off to make sure there isn't black residue. Heat fixing the slide will make sure the bacteria, yeast, or fungi cells stick to the slide. After letting the slide cool for a few seconds, dip the slide into the light blue stain called the fixative 10 to 15 times slowly. Then dip into the red stain 10 to 15 times. Dip into the purple stain 10 to 15 times. Each slide should be blotted before going into the next dip. Rinse the back of the slide using distilled water, then tap the side of the slide on a paper towel to get rid of excess water. Allow the slide to air dry, or it can be briefly dried with a hair dryer from a distance. Finally, examine the dried slide under oil immersion to determine whether yeast, bacteria, or fungi are present.